Hey folks, Dr. Jeff Williams here with Creekstone Integrated Care right here in Amarillo, Texas, with yet another low back study that we can put into our win column for the common treatment protocols in a chiropractic office. Now, some chiropractors simply aren't able to employ physical rehabilitation as part of their practice. Many just don't have the space available to perform rehabilitation in a meaningful way. However, most chiropractors will, at the very minimum, send some exercises home with the patient to be done on their own in the privacy of their own homes. Whether a chiropractor has patients actively perform rehabilitation or whether they encourage patients to be performing at-home exercises, exercise recommendations are a big part of common chiropractic treatment protocols. So, here's why they did this research. Not only is low back pain extremely common, but so is the recurrence of low back pain. The authors of this paper wanted to delineate whether or not exercise intertwined into the treatment or as a post-treatment protocol was the most effective form of implementation and what was effective in preventing recurring low back pain. So here's how they did it. A comprehensive search was performed, including Central, which is the Cochrane Library, 2009, issue 3, Medline, Embase, and Cinal, I hope I said that correctly, CINAHL. The search was conducted up to the year 2009. Papers were accepted under specific criteria, such as subjects having had back pain before, an intervention that consisted of exercises alone, outcomes measuring recurrence metrics. Two authors independently reviewed the material for acceptance. The studies were divided into post-treatment intervention and treatment studies. Results were combined with meta-analysis of subjects, treatments, controls, and outcomes. Now, here's what they found. They ultimately reviewed 13 articles that reported on 9 studies with 9 interventions. 4 studies had low risk of bias, while 1 had a high risk. The others were undetermined. There was moderate evidence post-treatment exercise was more effective in reducing recurrence than was no treatment at the 1-year follow-up. There was moderate evidence the recurrence rate was significantly reduced in 2 of the studies at the 1.5 years and at the 2 years follow-up. And there was conflicting evidence as to whether or not exercise alone as a treatment protocol was effective at all. So let's wrap it up. There was moderate quality evidence that post-treatment exercise programs can prevent recurrences of back pain, but there was conflicting evidence found for exercise as a treatment all by itself. Although this study was not really intended to test the validity of physical therapy as a treatment itself, physical therapy is essentially exercise and stretching. The study suggests to me that physical therapy alone may not be the best protocol for low back pain, and in my opinion, could be better if combined with manual therapy and spinal mobilization, aka chiropractic. So, just another reason to call a chiropractor today. Research and clinical experience shows that in about 80 to 90% of headaches, neck and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, it's more cost effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. And we do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on the part of you, the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising your general overall level of health. Please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think. Tell us your thoughts down in the comments section below. Please make sure to come find us on social media outlets, places like Facebook, Twitter, Pinterest, LinkedIn, Google+, and Instagram. And make sure you subscribe to our YouTube channel by hitting the button below. But at the very least, do us a favor, please, by hitting the thumbs up button below. It really helps us get in front of more and more people with some information that we hope over time will start to make a difference in our profession. Thanks again, and until next time, have a blessed day.